All right, deep divers. Ready to dive in today. We're tackling something I think we all think we know about alcohol. But we're going to see if we really do.
Right.
We've got global reports. We've got some myth-busting fact sheets.
Yep.
We're even going to take a peek into the history of alcoholism.
It's going to be fun. It's like that friend who shows up with a random assortment of stuff for show and tell, and you're like, I don't know what we're going to talk about.
Yeah.
But it's going to be good.
Exactly. And our mission with this deep dive is to give you the need-to-know information, give you those surprising aha moments, maybe even a question or two that'll have you pondering your next drink.
Or at the very least, the next time you hear someone spout off some alcohol-related wisdom at a party, you'd be like,
Yeah.
I'm not sure that's actually true.
Yeah.
Let's unpack that.
Exactly right. Which brings us to our first stop on this journey. Busting some common alcohol myths.
Right.
You know, like, does mixing different types of alcohol really get you drunker faster? 1 minute you're sipping wine, the next minute you're doing the Macarena on the table because you switched to tequila?
Right.
Is that the tequila talking, or is there something else going on?
It's a classic. And while tequila might have a reputation for making people a little more uncoordinated,
Yeah.
it's not the mixing itself that's really the culprit here.
Oh, really?
It's really about how our behavior changes when we mix drinks. Think about it. We tend to make those sugary, smooth cocktails when we're trying to kind of like mask the taste of the alcohol a little bit.
Which means we drink more of it faster because it tastes good.
Exactly. And that, my friend, is the real reason you might be feeling the effects faster. It's not the mixing itself. It's that those smoother drinks sometimes lead to overindulging.
So it's not the tequila sunrise that gets you. It's that you had 3 because they tasted like a tropical vacation.
Exactly. And that brings us to a really important point, I think, which is understanding the facts about alcohol can really help us make more informed choices about our consumption.
Absolutely. Knowledge is power, even when it comes to something like alcohol.
Yeah, one thing that I thought was really fascinating, we kind of went down this rabbit hole of looking at the history of alcoholism.
Yes.
And how that's evolved over time.
That article from the Public Medical Center was a trip.
Yeah.
You know, one thing that really stood out to me was that alcoholism wasn't always considered a disease.
Yeah, it's remarkable, isn't it? For the longest time, excessive drinking was viewed as a moral failing.
Yeah.
A weakness of character.
Yeah, you have a drinking problem. Well, just stop drinking so much.
Yeah, exactly.
That is not how we view it at all today.
Not at all. And I think that's a really important historical perspective to kind of sit with for a moment, because it helps us understand why certain societal responses to alcohol use and misuse emerged.
Yeah.
Right? And how our understanding of addiction more generally has evolved over time.
Right. It completely changes how we view not just alcoholism, but addiction in general.
Totally.
It's like realizing the world isn't flat. It totally changes how we think about things. So speaking of viewing things differently, let's zoom out and look at this globally.
Sure.
We've got this report from the World Health Organization, and it kind of gives us a snapshot of how much the world's drinking.
Yeah, what that means for everybody.
Yeah, it's really interesting to see some of these global patterns.
So first things first, how much are we all drinking these days?
Yeah.
Is it increasing, decreasing? What's the deal?
Well, actually, global alcohol consumption has decreased slightly since 2019.
Oh, really?
Yeah, just a little bit, but still notable,
Interesting.
considering previous trends.
Yeah, I wouldn't have guessed that.
Yeah.
So what's driving that decline? Any theories?
It's a good question. The report points to, you know, a number of factors. I think it's like evolving cultural norms, right? Growing awareness of the health risks associated with drinking. Even economic factors in certain regions.
Right.
You know, so it really highlights, I think, how our relationship with alcohol is influenced by this complex interplay of social, economic, and even just individual factors. It's like a giant puzzle, and we're trying to put the pieces together.
Yeah.
Okay, so overall consumption down a bit.
Yeah.
What about regional differences? Because the report did mention that Europe has the highest per capita alcohol consumption.
Yeah.
Any surprise there?
Not really. Europe has pretty consistently held that title.
Yeah.
And, you know, there are centuries of historical and cultural factors that contribute to that.
So unpack that for me a little bit.
Well, I mean, think about it. Europe has such a long history with wine production, you know, particularly in countries like France and Italy and Spain.
Right.
Alcohol is so often woven into their social customs, their culinary traditions, even religious practices in some cases.
So it's not just about drinking to get drunk. It's about preserving a cultural heritage.
It's exactly. These deeply ingrained cultural norms really influence everything from the types of alcohol that people consume to, you know, how often they drink.
Right.
And in what settings.
Makes sense. What about other parts of the world? Anything in there that surprised you?
Yeah, one thing that stood out to me was just how prevalent binge drinking is.
Really?
Yeah, the report estimates that around 38% of drinkers globally engage in binge drinking.
Wow, that's higher than I would have thought.
Yeah, it's a significant number.
Mm-hmm.
And it really raises questions about the long-term health implications of that kind of drinking.
Yeah, because even if the overall consumption is down, if people are just drinking a ton at once,
Yeah.
that's still not good for you.
No, it's not good for you. And that's why the report really stresses the need for, effective policies to address not just the overall amount of alcohol consumed, but also the patterns of drinking.
So it's not just how much you drink, but how you drink it.
Exactly.
Now, this report, I think it feels like a little bit of a call to action.
Absolutely. It's a call to action.
It's not just a bunch of statistics and figures. They're saying, hey, we need to do something about this.
Yeah, it really highlights the urgent need for this kind of comprehensive approach to reducing alcohol-related harm, right? Whether that's public health messaging, policy interventions, improving access to treatment.
Yeah.
Attacking it from all angles.
I like that, attacking it from all angles. Before we dive into the policy responses, though.
Sure.
There was one other thing in the report I wanted to touch on, and that was that it did mention some potential protective effects of low-level alcohol use for certain conditions.
All right, we have to be very, very clear here. Any potential benefits are limited to very specific conditions.
Yeah.
And it's absolutely not, a green light to start pounding beers for your health.
So no doctor's note for that extra glass of wine?
No, definitely not. The science is really complex and it's still developing, and it's so important to consult with your doctor.
Yeah.
Before making any decisions about your drinking based solely on this report.
Yeah.
But that being said, for some individuals, moderate alcohol consumption might offer a slight protective effect against certain conditions like heart disease.
Interesting.
Yeah.
So moderation is key, as with most things in life.
As with most things.
Speaking of moderation, what is being done globally to address the harms associated with alcohol? What's working, what's not working, and what needs to change?
Yeah, well, the WHO report looks at a range of policy responses. Things from taxation and marketing restrictions to even just limiting the availability of alcohol.
So are these strategies making a difference?
It seems like there's a long way to go.
Okay.
More and more countries are at least developing written alcohol policies, but actually putting those into practice.
Right.
That's where things get a little tricky.
It's like having a great workout plan.
Yeah.
But never going to the gym.
Exactly. What's holding things back?
Well, the report highlights some key challenges in translating those policies into action. For example, inconsistencies in how minimum drinking ages are set, even for different types of alcohol within the same country.
Wait, really? Because if we're trying to prevent, underage drinking, shouldn't the rules just be really clear on that?
Mm-hmm.
You'd think so, right? But as this report reveals, those inconsistencies can actually undermine the effectiveness of these policies.
Mm.
Because if you can legally buy beer at 18, but you have to wait until 21 to buy spirits,
Right.
that creates confusion and might even encourage riskier drinking behaviors among young adults.
So inconsistencies equal loopholes, and those loopholes have real-world consequences.
Exactly.
Okay, so what else, what other hurdles are we facing in this global tug-of-war against alcohol-related harms?
Well, the report shines a light on something that might not be all that surprising.
Okay.
And that's the influence of the alcohol industry
Of course.
in shaping alcohol policy. In fact, the report states that nearly half of all countries reported some level of interference from the industry when it comes to alcohol policy.
Wait, hold on. So you're saying the alcohol industry is trying to influence the very policies designed to regulate them?
It's complicated, but yeah, that's essentially what's happening.
It's like letting the socks guard the henhouse.
This influence can take many forms. Lobbying efforts and funding research that supports their interest, to even promoting self-regulation as this alternative to stricter government control.
So it's this constant push and pull between public health priorities and the economic interests of this massive industry.
Absolutely. And this tension is evident throughout the report. On one hand, there's this clear acknowledgement of the harms caused by alcohol and, the urgent need for effective policy solutions. But on the other hand,
Right.
we see the challenges of actually implementing those solutions in the face of industry pushback and the reality of diverse cultural norms around the globe.
It's like this global game of chess.
Yeah.
Where everybody's making strategic moves and counter moves. So where do we go from here? What happens when those efforts to curb alcohol use bump up against the realities of addiction?
That's such a crucial question, and it's something the report dives into as well, because even with these prevention efforts in place, there will always be people who need help addressing alcohol use disorders.
Right.
And that brings us to the topic of treatment.
Okay, let's talk about that, because even with the best intentions and the best prevention strategies, sometimes people need a lifeline. What does the report say about treatment options for alcohol use disorders? What does that landscape look like? It's like we're building this safety net, but there are holes in it and not everyone has equal access.
Right.
So let's talk about the holes. What kind of treatment are we even talking about here, and where are the gaps?
So the report talks about two main types of treatment. There's medication-assisted treatment,
Okay.
and then there's psychosocial interventions.
Okay.
So medication-assisted treatment uses medications to help reduce cravings,
Okay.
manage withdrawal symptoms, and then psychosocial interventions are things like behavioral therapies,
Right.
support groups,
Dude,
things like that.
So kind of a two-pronged approach tackling the physical and the mental, emotional aspect.
Exactly. And ideally, you'd want access to both types of treatment.
Right.
But unfortunately, that's not always the case.
Of course not.
The report found a big gap in access to medication-assisted treatment,
Yeah.
particularly in lower-income countries.
Yeah, that's not entirely surprising. Unfortunately, access to healthcare and economic factors kind of go hand in hand.
Yeah.
What are some of the reasons for this gap?
Well, cost is a huge factor. Those medications can be expensive, and a lot of lower-income countries just don't have the resources to make them widely available.
Right.
And then on top of that, there's still a lot of stigma surrounding addiction, which can prevent people from seeking help in the first place,
Right.
or even make healthcare providers hesitant to offer it.
It's like this vicious cycle. Lack of resources means limited access to treatment, which perpetuates the stigma, which makes it harder to get more funding and support.
Exactly. It's this complex issue with no easy solution.
Right.
However, the report does highlight some bright spots.
Okay.
For example, it emphasizes the importance of those psychosocial interventions that we talked about,
Okay.
which can be more accessible
Right.
and affordable, even in resource-constrained settings.
So even if the medications aren't available, there are still ways to help people
Absolutely.
on their journey.
Yeah, and another really important aspect of all this is this thing called the Service Capacity Index for Substance Use Disorders,
Okay.
or SCISU for short.
SCISUD, got it. I'm not going to lie, that's a mouthful.
It's a mouthful.
What does it actually measure?
Basically, think of it like a global report card
Okay.
for addiction treatment infrastructure.
Okay.
So it assesses a country's capacity to actually provide treatment for substance use disorders,
Okay.
looking at things like the availability of specialized services, the number of trained healthcare professionals, the level of government investment in treatment programs, all of that.
So you can look at the SCI-SUD scores and kind of see, oh, these are the areas where the gaps are really the biggest.
Exactly.
It's about using data to drive action and really prioritize resources where they're needed most.
You can't manage what you don't measure.
Exactly.
So speaking of managing this global issue, the report ends on kind of a call to action.
It does.
What are your takeaways? What are the most critical next steps?
I think the biggest takeaway is that we need a multi-sectoral approach. This isn't just a healthcare problem.
Right.
It's a social issue, an economic issue, a cultural issue.
We're all in this together.
We're all in this together. We need governments,
Yeah.
communities, healthcare providers, individuals all working together.
It's a big ask,
It is.
but it's important.
It is. We need stronger policies to reduce overall consumption. We need increased investment in treatment programs, more effective education and prevention campaigns,
Yeah.
and honestly, like a fundamental shift in how we as a society view and address addiction.
Absolutely. Well, deep divers, we've covered a lot of ground today.
We have.
We talked about those myths surrounding alcohol. We journeyed through history to see how our view of addiction has changed.
Right.
We zoomed out and looked at global consumption patterns and the challenges of making really effective policies.
It's complicated.
But it doesn't end here. This report, while incredibly insightful, didn't really dive deep into some of those social and cultural factors that can influence alcohol use and misuse.
Right.
Things like advertising social norms, economic inequality, these all play a role.
Absolutely.
So as you continue to learn about this complex issue and you encounter a different perspective, think about how those factors might be influencing what you're hearing.
Yeah, that's a good point.
And ask yourself what else beyond policy changes could make a difference in reducing the harm caused by alcohol.
It's a question worth asking.
It is. Keep diving deeper, stay curious, and we'll see you next time for another deep dive.